Hi, welcome. Thank you for being with us. We're going to wait one more minute so that we allow time for everybody to get a chance to join the webinar today. And 1 minute, and we'll get started. As you can see here on screen, we are offering the option of hearing simultaneous interpretation into English. You can do so by clicking on the globe icon at the bottom of your screen and selecting your language if you prefer to listen in English. One more minute and we'll get started. Very good. It's a pleasure to see so many people here today. Welcome, everybody. We are very, very excited to see so many people joining the conversation today. I'm Evan Rothaus. I'm the project manager at the Center on the Developing Child at Harvard University. And it has been my pleasure to work with the IDEAS framework. I have had the pleasure working with people from all over the world, I mean, in particular with people from Latin America. So I'm so happy that the digital handbook is already available online. Before we start, I would like to point out that there is simultaneous interpretation available for those of you who prefer to hear in English. You can access the interpretation at the bottom of your screen by clicking on the circle icon, the globe icon, and we will post those interpretation instructions on chat right now. Very well. As I said before, we are so happy to be able to speak to you today about this new resource. And the IDEAS framework is a product of over a decade of the initiative Frontiers of Innovation. And you were our partners in this effort during the last few years. Even though our team at the center doesn't offer direct training about the IDEAS framework, we are very excited to be able to offer this to you as a free resource and free access resource. And I hope that this format is going to help to make this IDEA framework become available to innovators in the field of early childhood development. And briefly, a little bit of history. This framework was developed in collaboration with the the School of Education at the University of Washington and with the Neuroscience Center at the University of Oregon, with the support of the Gates Foundation, Lego Foundation, Porticus, and the Chimera Foundation. If you would like to learn a little bit more about this story, I invite you to invite the page, the background and history page. And there you can get more information about the different collaborators and all those that made this work possible. We can post on chat right now the link to the digital handbook so that you can review the resource itself and you can look at the page and find all the different stakeholders. The session today has 3 main parts. First of all, we're going to give you some orientation about the digital handbook in general. Then after that, we will hear from 3 members of the community, the FOI, that have put this approach into practice, and they will tell us how to apply this in the context of the real world. They are Ana Maria Serrano from Mexico City, Jose Manuel Luera del Rio from Oaxaca, Mexico, and Yesenia Alvarez Gonzalez from San Antonio, Texas. And lastly, we will end with a Q&A session where our panelists will be able to respond to all the questions that you've been sending to us during the chat. Now, before we get started, very quickly, we're going to send you a survey. Among all of those present here today, it will pop up on your screen in a minute, and this will give us an idea of who is here today. As you can tell, these are questions about how familiar you are with the IDEAS framework. You can say, I am not familiar with the framework. I have read about the framework on the website. I have attended a training about the IDEAS framework, or have experience using the IDEAS framework at work. So we'll wait for you to respond to the poll, and that will give us an idea of who's here for this event today. Very well. Now we're going to conclude the survey, the poll. If you haven't replied yet, you can do it still. And well, I see most of the people here today are not really familiar with the IDEAS framework, and this is new content. Perhaps you've read a little bit about it on the website, but you really have not gone in depth. You haven't gotten training. That's very exciting. That gives us a chance to include even more people from our community so that you can use this framework, or at the very least, so that you know about the framework. So thank you so much for being with us today, so that you can learn more about this, about the handbook and about the resource. And I hope this is really valuable for you. And very well. As I mentioned earlier today, I'm going to provide you with a very quick virtual visit to the virtual handbook. We're going to show you the link again. We're going to put it on chat in case you want to access it now. As I'm speaking to you, I will also share my screen so that you can follow it throughout the webinar. We are not going to review all the content. It's all online. It's all available. You can access it anytime. So instead, I want to review the key elements so that you can get an idea of what it is, what it includes, and how to use it. So now we're going to share my screen. 1 second. Here it is. Very well. I believe you can all see it. As I said before, if you have the link, you can access it from home as well. So let's start on the home page. And you can go into this home page anytime using this logo that you see on the top left of the page. And this page gives you an introduction to the handbook. We start first with who this is for. It's for anybody who works in development or application of programs for children and families, especially if they want to keep implementing or improving on what you're already doing. The next section describes what you will learn. That includes applying the main principles for guiding principles to achieve a greater impact, to develop a clear and precise theory of change, and design an evaluation to investigate, and then to get continuous improvement. Then the next page shows you how to use the handbook. So the first time that you use the handbook, we tell you how to start. You start by the general description of the framework, then the theory of change. That's the second section, is theory of change. Then comes evaluation, and then program development. And you will see these sections correspond with the tabs here on the top of the page. so that you can access everything from there. In each section, you will find materials to think of questions, to reflect independently, or things to discuss with your team. Discuss instructional examples and related resources, things that you can download. The content varies. Reading the whole thing may take an hour or so, but working as a team with the handbook and with this approach and to have access to all the resources can take a lot longer. But of course, you decide. Yeah, you decide the rhythm that you're going to have when you're using it. Then we have a rotation of we have examples of testimony from people who have used it and applied it, and people have applied this to their work, and some of them are here with us at the webinar today. And at the end of each page, you will find what we call a call to action that invites you to move on to the next session in the manual. And then at the end, I want to mention that there is a section at the bottom here. It says here, it mentions all the background, and then, of course, thanks, as I mentioned earlier. I'm going to click here to start with the summary and a general description of the framework. And here in the next section, you find an introduction to the framework, including a section about why we need to have a new framework for innovation in the field of early childhood development. And you talk about the common challenges and the efficacy of programs. When you review programs, products, and services for early childhood, the effects have been really modest. They really haven't improved over time. And we believe that part of the problem is that the conventional approaches for early childhood development and for evaluation of programs, they can sort of put the brakes on what we do sometimes. We can get more information about each one of these matters just by clicking here. Is issue here, and all these boxes to get more detail about these matters. So the IDEAS framework was designed to help approach these challenges. An IDEA means innovation, development, evaluation, adaptation, and take up to scale. And the use of this framework, IDEAS framework, allows us to go beyond, the fact that whether an intervention works or doesn't. It allows us to ask ourselves critical questions. Among them, for instance, what works, how it works, for whom does it work, for whom it doesn't work, and in which context it works. Mm-hmm. Now you find a number of other sites that you can visit. Is concepts, ways of working, things that were written in the past. And when you click on them, each one, when you click on each principle, you can find more information and a short video where you get innovators in the sector that have used the IDEA framework in their work. These 4 principles are precision, rapid iteration cycle, co-creation, and shared learning. Then you find how to put this into practice, how to put these guiding principles into practice through 3 key components: the theory of change, evaluation, and program development. And these are like the focus of attention of this handbook and or manual. And you will see that those are also on top of the screen. And again, you can click on the on each section here so that you learn more about each component.
At the bottom of the general description, there's a section about a program, how to program, called El Bucecito, the small bus. Use the IDEAS framework to promote a larger impact of their program in Colorado, the U.S. The Bucecito is used as an example, the whole manual, to show how the IDEAS framework can be used in monitoring. Now we move on to the theory of change. This page is divided in 3 parts. This is one of the 3. The first section defines what the theory of change is and introduces the ideas focus of the theory of change, which includes 4 domains. Here, the strategies, the objectives, the outcomes, and then moderators. And if you click here, you get more information on each aspect. Then we have a library of examples of theory of change from organizations that have used the framework in their work. These theories of change, for the most part, are in English, but in spite of all of that, we think they can be useful, and you can also use a translation app, translation platform, if you want to translate it. This part is how to develop a theory of change, and this includes a template of the theory of change, which you can unload in PowerPoint, and also a printable poster for work in person. Due to some feature of this platform, which I don't understand very well, but our communications team knows better than I do. Some of these sections are connected to translations, English, Spanish. You see at the top, you can switch between languages. But now, since these downloadable resources are connected for some reason, we cannot get the translation into Spanish. So when you download it here, when you download it, it's a template in English. But here, if you go to resources, you have them in both languages. So sorry about the confusion. Maybe we will see at some point how to fix that. But everything is available in Spanish in this resources tab. You can click there, and we will go there in a minute. You can see both sections, or both resources in both languages. Very well. Next, we're going back to look for more information. These are the instructions step by step to develop the theory of change, strategies, objectives, outcomes, moderators, all the details that you need. And then we go back to the example of the little bus, El Bucecito, to see how they've used the theory of change to move forward their work. And you can download the theory of change, both in English and Spanish here. I'm going to click here, how to use the theory of change. And then the last section of the theory of change orients you on how to use the theory of change to generate hypotheses, to test, and how to learn what the manual takes us next to evaluation. I'm going to fly through this part to make sure we have time to hear from the panelists. This is an excellent section, also organized in 4 parts. First part says objectives and planning of the evaluation. It recognizes that there are many reasons to compile data about a specific program, and it suggests that an important use for the evaluation data is to research the theory of change and to look for opportunities of strategic adaptation and to promote continuous improvement. Second section presents a 3-step process to planify an evaluation based on the theory of change, which is to identify past questions on the theory of change, to choose and evaluate the design, to select measurements, and the manual goes deeper into those steps in the following sections. There is also a downloadable worksheet to work on fast cycles that your team can use to identify evaluation based on the theory of change. This is also in English here, but if you go to the resources section, you can access it in Spanish. And this takes us to the last part of the selection of the measurements. Now we go into the development of the programs. In the final section, you learn to use what you learned in each evaluation round to achieve a greater impact. There's some obstacles that might come up, the quick iteration, and how the IDEAS framework helps to overcome the challenges by answering 3 questions. What does the data say? What does it mean? What are the implications? And what do we do now? How could we perfect or refine the theory of change? What are the implications of the program development in the future? Finally, we go to the resources page that I mentioned. Here, there are many resources and tools and templates that can be used and downloaded here. Many are available only in English, unfortunately, but the ones that are available in Spanish have this message in green that you can see here that says it can be downloaded in both languages. Very well, I'm gonna stop here. And I know that was a lot of information and it's a little bit difficult to digest so much information, but now, fortunately, we will get a chance to chew on it a little bit. And now it's a pleasure for me to give the floor to my colleague, Priscilla Pumarada. She's the Chief of Staff at the Center for the Developing Child at Harvard University, who will introduce the panel and guide the conversation. Priscilla, the floor is yours. Thank you very much. It's a pleasure for me to share this tool with you. We have been using it for many decades, and also it's great to translate it now in Spanish so it can be used by many more people. Now, we know there is a long way from just saying something to doing it, but the pages there, you will be able to review it when you have more time. So now, during the next half hour, we will be talking about how to actually take this into practice. And it's a great pleasure for me to introduce 3 colleagues who were and are a part of the innovation frontier community. So I'm going to introduce them. They're going to talk a little bit about their program, and then we will compile the questions that we receive when they registered, and we will have a Q&A section. So with that, it's a pleasure for me to introduce the panelists, Ana Maria Serrano, Jose Manuel Loera de Rio, and Yesenia Alvarez Gonzalez. Ana Maria Serrano is the founder of the DEI project and community in the city of Mexico. She has a degree from the Autonomous University of Mexico, and she has a master's from the University of Chicago. Ana is also a writer. She published a text on early childhood, community training, community, and also she has published children's stories. She will be talking about the pregnancy well-being program. That's what Ana will be talking about. This is a cluster within that Innovation Frontiers program in Mexico. We also have Jose Manuel, the operations director of civil society organizations. Crecemos, we grow in Mexico. He's an attorney with a long history of working with civil society. He's in charge of many projects in the public sector. One of the most notable one is my mother tells stories. My father also counts or tells stories. And this specific project was the result of work launched by the CENSA and the Coppel Foundations. Finally, we have Yesenia Alvarez Gonzalez. She's the director of the Avance program in San Antonio, Texas. She's been working with Avance for over 20 years. She teaches classes for her parents. She's in charge of leadership programs and resources. Yesenia is a daughter of Mexican immigrants. She's the first one who finished high school and college in her family. She graduated from the San Antonio College. She has a master's in management and leadership of nonprofit organizations at the University Our Lady of the Lake. So, with this, we will get to hear a little bit more about the programs and the work that these three people do. Anna, can we start with you? Can you briefly describe what your program does? How have you utilized the IDEAS framework? And if you can choose a specific component and tell us how you have used this tool to have an impact on the work that you're doing. Priscilla, it's a pleasure really to share with you. This is a subject that I'm passionate about. First of all, I think I share with all the people who work in early childhood and issues of vulnerability and poverty. We're really anxious to do a lot of things. Reality is very complex. There are many structural problems. We always trying to do everything at the same time. We have programs. We put them on our desk. We put them in practice, and then we have to make reports. And this is like a new lens to look through at the program with the problem, which is very complex. There are many variables, but to look at a segment and say, well, what is the objective of the program after the first implementation and in the long term? Those are like those three marvelous boxes that we see in the theory of change. So it's like, with your program what works, what doesn't work, and then test it. It's something that's really captivating for me, and I think is a wonderful focus is that it's okay to make mistakes. There's a value in making errors. When we finish this first pilot, we can see what didn't work, and that's very atypical in social sciences. We're used to only reporting success, but this is the only way that you can learn. As Evan was saying, we have to see what works, what doesn't work, whom does it help, and not just use averages. And I mean, it's very human, to talk about what worked, but going little by sections, by segments, for us was a complete revolution. We had been working on this program to reduce stress in vulnerable pregnant women and how to connect to the baby that was about to be born. But we didn't know exactly what worked, what didn't work. So this led us to try this methodology, and we were inspired by a workshop that we had with you, and we discovered a tool that was great, going to the market and doing some nail painting, and that way we would get young women to talk. We had a spa to bring vulnerable pregnant women where they could, receive massages and do their nails and their hair and get information. And we had a great success. We advertised it a lot. We thought it was going to be great, but only two people came. We had everything, the massage specialist. We had somebody there ready for everything. But the two people who came really, they said that people really didn't trust such an offer, that we were inviting them to such a nice place, and that's why they didn't come. So we ended up going to where these pregnant women were, instead of having to or trying to attract them to our location. So that was the first big lesson. Don't do the work on your desk. Go out there, see what the population needs and what's required. So that was really interesting. And to have the freedom to report that we had made a mistake, that freedom, that was great. So what's the program about? It's a program about, it's ludic, it's about playing. The woman learns to regulate themselves, to breathe, to keep a diary, to do yoga exercises to prepare for giving birth, and communicates with the baby through a little host that goes on their belly. And of course, the baby listens and moves around, and finally, they really feel that they're pregnant, and it has a great effect. The facilitators were very caring. They got very close, and they help them to not feel judged. So it's a very promising program. So we started testing it with that methodology. We went to the Tlalpan Health Center, and it was very important because that's where pregnant women used to go. And we started testing, testing, and testing. And we had some crazy things, some fun things go on. We had sessions of meditation. We know that meditation works, but the pregnant women were not really listening to them. They live in very crowded places. They were very self-conscious about listening to the meditations with all their family around them. So, we provided them with earphones, and, just with that methodology, we were able to realize all those things. And being self-critical. We said, yeah, it was a marvelous thing, but it didn't work in that context. So that was very important, very interesting. Another thing, thanks to the methodology, in the beginning, we were those young women coming, depressed, stressed out. Their hair was a mess. And we did a pre and post stress test. And by the time we did the post test, they were even more stressed than before. So how? I mean, that was counterintuitive. That was it went against what we were thinking. But we learned that they had learned how to manage their emotions, their feeling. And so the thing is, they did not recognize in the beginning that they were very stressed out. So that shows how we adapted methodologies, evaluations, materials. So those are the points that Evan was talking about. So again, this is how it's been working. This an ingredient that has been very valuable. I mean, the technique is very simple, very easy to share with whoever needs it. But the active ingredient is the warmth of the relationship between the facilitator and the pregnant woman. Anna, I'm gonna ask you to save those anecdotes, those stories for the next section for the Q&A, because I know you have very important stories to share, and I have them ready for them. So if you can hold on, thank you.
So with that, we also now move on to Juan. Juan, we would love to hear a little bit about your program, about how you have used the framework, and specifically, if you want to tell us an anecdote about one of the elements, maybe the theory of change, the evaluation, or the program development, or if you want to focus on one of the principles. It could be collaboration, it could be precision, it could be shared learning. So we want to hear from you before we move on to the questions. Of course, Priscilla, thank you so much for this space. And well, for us, the same. It's been a very enriching program. The same things that Anna said, that's very true. Answer the questions. What works for you? What doesn't work for you? And, to move out of this comfort zone where everything is very structured, where you have to focus on having some very concrete results. I wanted to talk to you about the guiding principles for this model. They're very important. And very quickly about what works for you. We asked that question. We have this program. My mom tells stories, so that's that. And we work in rural areas, and we have, in the academic area, we have dads depending on the area where they are, whether they're in the city or in rural areas, maybe they do have a bachelor's degree, but some of them have maybe elementary school, maybe high school. So we did an analysis of the population, knowing culturally where they are, what was the area of comfort for them, what were for parents who had a higher level of education. So what was the surprise when we got the results? It was that the program did not work better for parents with a higher level of education. It worked better for those that had a lower level of education. So what do I want to say with this? And it goes back to the principle that I want to focus on, is this idea of co-creation, the importance of this model. It makes you get closer to the community. You shouldn't look at the community from top to bottom. You should be working with them. You should listen to them, really, and you should be able to share with them. And each participant in the model, whether it's an investigator, an expert in early childhood development in this case, and then the community with this very different outlook, maybe we can together give shape to a program that really meets the needs of the community. So we involve the community, and the program used to be called Mi Mamá es Puro Cuento. My mom is a story, tells a story. So the experience tells you that mom is the only one that's responsible for rearing the children. She is the one that raises the children. If dad is with mom, that is positive, but if he's not, that is very common. And if he's there, he doesn't participate. So the question was, does it work for dads or not? And we thought it wouldn't work because they wouldn't participate because they're at work, or they have different activities, they're not interested. Culturally, there's a lot of machismo. So the teacher who represented the community said, why don't we try? And maybe if we try it could be an alternative. So we added dads. So as I said before, the name of the program is, My Mom Tells a Story. So we added the complementary program. My dad also has a story. And mi papá también cuenta. It's, it's telling a story, basically. And the surprise we have during the first workshop is, in fact, there wasn't any participation from dads. It was just moms. But one of the strategies was home visits. So we went to visit their homes to see how they were implemented the program. The surprise that we got was that dads were actively participating in the development of strategies at home. So, this was a space where they spent time together. So the model is something that teaches us that the co-creation breaks the stereotypes that we have because of cultural reasons. So by asking these questions, we're working with the model nowadays. We want to start working with musical teaching. We're beginning with this model in another sector, and we want to introduce this model to different programs step by step so that it becomes a routine. It becomes the norm in the way our organization works, especially because we have to adjust to reality. And those that are working on this, we know that donors always ask that our projects become sustainable and that they can be duplicated, and especially that they can be taken to scale. So the model helps perfection this so that you can design these programs, and this program has been recognized as good practice now because we have implemented it according to good ideas in both contexts, rural and urban. And for us, that is a great satisfaction. We're very happy. Thank you so much, Jose Manuel. You have touched upon several areas. So, there are no things that are against the other. I mean, I'm sorry, I call you the name of a cousin here, but you have co-creation and you have reiteration, and how those two things go hand in hand and they're not strangers to each other. But before we move on to questions, because I know that there are several questions from the audience here, I want to introduce Yesenia. Yesenia, thank you so much for being here. And I know that the audience wants to learn a little bit more about your program, how you have used the model, and how the model, how you use this as a tool, and how this methodology has helped you learn and make the program grow. Thank you so much, everybody, for the invitation. Here in Avance, what we have is a 9-month program, and it's in San Antonio, Texas. We have 3 chapters. We have one in Houston, Austin, and Dallas. But when we went to learn about the IDEA framework, we came back very excited, all of us, to learn about how the program that we have had for over 40 years and the study plan that we had implemented for these programs, how could we advance or go beyond? Because after 40 years, the resources, the methodology, things have changed. And we were going through a phase, and that was in 2018 when we attended. We learned about the framework, the IDEA framework. And we learned that we also had to think beyond so that we could we could advance our mission, the advanced mission, to more families, because we've been here in the US, in Texas for several years, but we wanted to explore. We wanted to develop, to learn how to develop the programs that we had for moms and for babies, and do so in other places, in other states, not just at centers like we have been operating so far, but also in schools, and to involve families, early childhood, families even more. So what we have are classes for parents for 9 months, and the parents and the kids come together and they learn together at a center or in different places. We teach them how to make toys by hand. That is part of the teaching plan. And they learn about resources in their communities. And we also provide home visits and transportation. And we have done so for several years. But when we learn about this IDEAS framework, and the team gave us an opportunity to really think, to think beyond, and to think, how can we have a bigger impact? How can we develop the program for moms and dads to get them more involved, to get the family more involved in the communities where we are? So that was an opportunity to develop together and to implement, how to teach the classes. And then, as we all remember, COVID came. Yes, in fact, it did. So at the time when we were all at home and we couldn't leave, that helped. It helped us so much to have this IDEAS framework, because we had to basically change very quickly how we're going to teach the classes, because everything used to be in person. And now we say, how are we going to do the evaluations? How are we going to take this information, these resources that we have, and still offer it to the families? So we had to switch quickly. And the teams that we have here with this, we help with the IDEAS framework. We decided to do it virtually. We decided to go remote and to teach the class, remotely, and to bring videos and resources for the families and the families that need that connection with us. And then after COVID-19, passed, right now we are exploring to see how we can evaluate, because also now with this IDEAS framework assistance, we are looking at different ideas to see what kind of theory of change ideas we can implement. And one of the ideas was how to bring and how to evaluate the social determinants of health for a family, because we are thinking beyond that. Those are the opportunities that we have had. And I tell the team, those of us that are here right now listening to us, don't be afraid. Consider participating in this in this idea they're offering us, because I remember we went with a lot of excitement, but as soon as we started, it took a while, but the team has been with us at every single step. And we started in 2018. Thank you so much, Yesenia, for sharing, not only because of how you use the tool, but how you use it at different times.
To the three panelists, thank you for showing that curiosity to learn and to being vulnerable. I mean, when you ask big questions, you have to be willing to hear the answers. And if you want to ask or find out what's working, what's not working, you have to be open to receiving that information, that response. And during COVID, we saw many people who were already using the model, and they were able to use it timely. They had to reprogram it, how to use the iteration cycles to try new things and see whom it was working for whom it wasn't. So thank you very much for turning a situation into an opportunity, so that those who were beneficiaries of the program would not be without it. I think this is a perfect moment to continue with the questions or move on to questions. Thank you to everybody who registered and sent questions. We have grouped the questions. I'm going to ask some questions, give the opportunity to some of panelists. We have about 10 minutes for this. So I think if we take 2 minutes per person, I think we will cover at least 2-3 questions. So, Yesenia, I think you started to talk about this. Among the questions, one of them is, what are the challenges that you faced bringing to your organization or putting into practice the IDEA framework? Yesenia, thanks for already sharing one of those. But so I'm going to give the floor to Jose Manuel and Ana. Jose Manuel, I know you started talking about that. I mean, between what you're saying, what you do, there's a big stretch there. So sharing what you learned would be beneficial for this community. Yes, I have been pondering this question from several viewpoints. First, I think the three of us have said this. We have to be able to have this disruptive ideas, to break with the traditional models. I think that's basic. Yes, we are plunging into a notion of possibilities, and you have to have this capacity to take risks. Another big challenge that we cannot minimize is that the funders want very concrete results. So finding funders to implement the model is not that easy, but there are other mechanisms to raise funds, from people, even organizations who are ready to bet on research, because certainly the model has many facets of research. And the third thing is that you have to let the communities go. You have to let them fly. In the case of us who work in different communities, rural or urban, the idea is that the programs will change the context and they will be able to follow it. Our plan, my mama's whole tales, my dad counts, it has to be part of the curriculum in the schools, and it doesn't need us over the years. And to get parents more involved into education. So I would leave it at those three challenges for now. Thank you very much, Jose. It's very practical. I'm gonna give the word to Ana. Well, along what Yesenia shared, yeah, the pandemic was a real challenge. And also what Jose Manuel said, funding. It's a very stressing time for civil society, in our case in Mexico, because we do have that aspiration. We want to have quick results and scalable results, but this implies a lot of patience, needs a lot of patience. So this has made things complicated. And it's also the political changes. Maybe we have partnerships with health centers, and then things all of a sudden are frozen because of the political reality. So it's been a complex situation, but we're moving forward. And as far as scalability, what you were saying, what we see is that it depends on the warmth of the people who are doing it, because and then it's easier to replicate. The technique is easy. We need some very easy training materials, but the warmth, the closeness, that's the active ingredient that we found, and we need to replicate. So that's our challenge: how to bring it to scale, train people so they can, when they replicate, also have that warmth, that closeness, and the funds, of course. I mean, we have clear ideas, but of course, we live in a context. So those are our challenges. Thank you very much for sharing. I want to say that in several projects that me or others have worked, we have seen that when we create that, develop that theory of change, obviously, we don't evaluate, obviously, the whole theory, and we do not attempt to evaluate the whole program, but rather to learn something from different components. And that also helps to manage the volume of the process, of course, but also with the financing, because you continue with the program 90% as it is, and you do an iteration in a smaller portion, and then after that you start scaling it up and adding it, and it becomes part of the program. So that has been an avenue that I have seen follow by innovators. So I'm sharing that story, and this leads us to the next question from the participants. What other benefits have you obtained from applying the framework? Things that maybe you were not expecting from the process or the tool. Yesenia, I think you started talking about some of these. So I'm going to invite you and Anna to discuss some of the unexpected benefits of the process or the tool. For us, something that we learned was having the opportunity to offer the advanced program, amongst other communities, not just in the city, but also in rural areas. So that we were able to bring that program, and it's a part of the education program that we offer, and it gave us the opportunity to think beyond on how to adapt, especially after COVID-19. But we learned that it's important to reach families that maybe cannot come to our centers. So we learned that we adapted during that time, remote or virtual. That's going to stay with Avance, and we can offer more programs in other cities, in other countries that we've been talking to about this. So with the theory of change, we learned what is it that we want to evaluate? What do we want to evaluate? What do we want to learn? We know it's a theory to start with, but we are at that stage now with the framework. We will be learning. And at the same time, and I tell this to everybody, we've been discussing this, that is it okay to make mistakes and to learn how to correct them? Because this is not a few months process, it's not 1 year. This is a lifelong process. And as long as the organizations continue to work and the mission continues, it's a matter of years. We've been around for 5 years. Each year we learn and we grow. Yesenia just reminded me of a phrase that the founder of the center uses a lot, is that, obviously we continue doing what we're doing, we're going to obtain the same results. There's no change, no improvement. So obviously that curiosity and that passion that I know we all have here, that passion to do the best and do our best, and how to do it in a systematic fashion. If you see, well, I'm seeing this pattern, it's true. Well, you develop a theory, a hypothesis, and then we have a process to see if that idea is actually feasible and we can bring it to scale. So, yes, we need a lot of curiosity and a lot of courage with the process. So it really aligns with the philosophy of our founder. Anna, you started to do your introduction, you started talking about the other things that have been, benefits of being in this community of frontiers of innovation or using this framework. We would like to hear more about this. Well, yes, it's been really nice. Thinking about those boxes where you have the strategy. The strategy has material, has way of sharing, methodology. So at the end of the course, you expect the result, and then we have another result, and for everything to be well aligned. So you can evaluate each one of the parts. Of course, you're saying let's not get overwhelmed trying to evaluate everything. But the truth is that is a part of us now. We have really incorporated that together with what Yesenia was saying. The errors, try and error, and we would get comments from people, but now we intentionally research to see whom it worked for, whom it didn't work for. So I think it takes that has been very valuable, but it takes courage, and now we've dared to do it, seeing who the program worked for and for whom it didn't. So this part of the program, having focus groups where people tell you more in depth what they're living through, that's been a great learning. And also, as Yesenia said, the COVID challenge, the pandemic challenge really put things on their head, but we all adapted, and we created training courses for pregnancy that we do online. We have trained educators for indigenous groups, and it's been great, being able to reach beyond what we dreamed of. So, and as Yesenia says, that has stayed with us. And these are learnings that, you recognize what doesn't work, but you're also happy about the results and how the process gets improved. It's very human. It's very interesting. And that's what science is for, to help us to, at least with working with early childhood. Thank you very much. And Jose, you mentioned something that we have heard a lot from the people we have interacted with this tool, or who have used it, is that, they come to use the tool with a specific program. They end up incorporating it into many different areas, many different programs in their organization. And sometimes when they move on to another organization, they use it. So I'm going to finish with that story that you shared with us, the unexpected benefit of applying and using the tool. So thank you very much, everybody. I'm going to give the floor to Evan now. Thank you, Priscilla. Thank you, panel. It was a really interesting conversation. Thank you very much. And well, this takes us to the closing today. Thank you very much, everybody, for accompanying us. Now, before saying goodbye, I would like to hear your comments about this discussion. So we're going to show a slide now with a QR code that'll take you to a brief survey. We will also put the link to the survey in the chat. And we would love to hear your feedback so that we know how to improve these events in the future. Thank you very much, Priscilla, and thank you to our panelists, Ana, Jose, Yesenia, for sharing your experiences and your learnings, lessons learned. And we really appreciate your willingness to share your stories, and even the challenges, to see how other people could use the framework in their own work. Thank you, our interpreters, Pablo and Diana, and the Brattle Square study for organizing today's event. The recording of this webinar will be available in the next few days in our YouTube page, and we will also share the recording and the survey with this group via email sometime during this next week. We hope this resource will be useful for everybody, and we wish you the best in your continuous mission to support children and families. Thank you very much. Goodbye.